688.
So they don't like anticubials, right? But if that's all I can. I'm just gonna check your temperature and see. Good job, Gabby. She did great.
I initially met Dr. Robertson through an appointment at Tri-County here for knee pain several years ago and had a referral to go see orthopedics. I've been doctoring for approximately 4 years for my knees with plans to have knee replacement done in August of this year. Prior to that, about a week and a half before that, I've also had hip pain, but my hip became very inflamed and I had severe pain. Went and seen Dr. Robertson again and was determined that I should have hip surgery.
Take deep breath.
It can happen. In her case, she had bad arthritis of one of her hips and then both of her knees, and they were all causing a significant amount of pain. So she needed to get them done in a relatively short period of time.
It was about 8 years ago, and then 4 years ago is when I seriously started coming in for injections and going through therapy to try to reduce that pain and eliminate that. But it just progressed to the point where it was bone on bone, and now the only option is surgery.
Once it gets to where you're taking pain medicine every day around the clock and you have to plan your day around your pain, then it's time to come and talk to us.
I am to get it over with. A little bit nervous, but it needs to be done. So, yep, I'm ready.
Okay, we're gonna put a mark on both knees.
Yes, you will.
Okay. Left and right. Ready? The knee replacement surgery itself, I think sometimes patients wonder if we're just cutting out everything that involves their knee and putting a whole new knee in, and that's not really what we're doing. What we're really doing is resurfacing the ends of the bone with metal. So we're making small cuts around the femur bone and on the top of the tibia bone, and putting a metal cap on the end of both bones with a spacer in between. Surgery takes about an hour and 10 minutes per knee. Okay. So about 2 hours, 2.5 hours, somewhere in that range. And then we'll let you wake up in recovery for a little while, and then we'll get you back in here. And then we cut some of the undersurface of the patella out and put a plastic spacer under that too. But it's still our own muscles and tendons that are controlling the knee. We're not excising those. Ultimately, each patient has to come to their own decision in terms of when is the pain limiting them enough that it's time to do joint replacement surgery.
What's the first thing you're going to do when your knee is fully recovered?
Probably go for a bike ride. Be at home, but I will go for a bike ride.
You really like bike riding?
I do. I do.
I've known Carla for about a year now. We actually share a desk, so sit just a few feet away from each other and have gotten to get pretty close in that year. She's definitely a team player and a great coworker and person in general. When I had first started at Tri-County, she was actually running our COVID line, just coming in each day, saying good morning, ready for the day, and ready to do her job. I guess I had just started hearing about the 500th joint recipient and, kind of seeing the little activities that we were having here at work. I actually did not realize that Carla was the 500th recipient.
I was excited. I know her personally from working through here, and she goes to my church too, so I was very excited for her.
We talked, just about the operation and what she would be going through, her recovery, that kind of thing. She never quite brought up, though, that she would be the 500th.
Today's session was fantastic. So every session that we have with patients, they never feel they're doing as well as they want to do. And sometimes the trick is that we're picking harder things for them to do based on what we knew they did last time. Like today, I was able to progress her from not needing both hands on the rail to one hand on the rail, and it really did. It challenged her differently. So they start to feel like they're not doing as well. And then I try to point out that, you're not doing as well in your mind because I'm actually making it harder for them. If each session they came and they did everything really easily, I'm probably not doing my job well enough. I need to keep progressing them. I need to keep advancing them within that limit that they can tolerate. So she's doing fantastic. I'm able to give her something new, something different every single time she comes. And if there's ever a day that she comes that it's just not going well, we just go backwards because, again, it is a roller coaster ride. So she might do really, really well one session, and then she does a whole lot the next day, and then now Thursday's session might not go as well.
On occasion, if I get up too quickly or not thinking about what I'm doing, I have a little bit of pain, but nothing that I have to take medication for.
I think she's doing awesome. Yeah, I mean, her x-rays look really good, but from a standpoint of just watching her walk, it's really fun to see. She's walking a lot better than she was before these surgeries, with less pain, really no pain. She doesn't have any limp anymore. She just appears much more comfortable, and I think she's recovering great. If we track out how these patients do, it takes them probably a full year to fully recover.
I've been waiting to do this for years. So between my hip and my bilateral knees, I could have done it a lot sooner and been so much farther advanced.